We are back with more What's Now, and right now we are going to focus on melanoma and skin cancer. Dr. Julie Karen joins us with some important information. Let's take a look.
I'd like to share some staggering statistics about melanoma. Melanoma has been increasing at an annual rate of about 40% each year over the past decade. That means that it's expected that there will be about 207,000 newly diagnosed melanomas in 2021. About half of these lesions will be invasive. The good news is that when melanoma is detected early, there is a 99% 5-year survival rate. Unfortunately, however, when diagnosis occurs after the melanoma has already invaded and spread to other organs, that 5-year survival rate drops precipitously to about 15%. So I spend a lot of time in my practice debunking myths about sun health and sun protection. We do know that 86% of melanomas are attributable to UV exposure or exposure to the sun. But what many individuals don't realize is that at any age, you can change your behavior and impact your risk of developing melanoma. So often I hear, the damage is already done. I was careless in my youth. But the reality is that if you start practicing sun-smart behavior, wearing a broad-spectrum sunscreen on a daily basis, seeking the shade, wearing sun protective clothing, you can dramatically reduce your risk of developing melanoma. Another myth relates to how inevitable deaths from melanoma are. I said how rapidly melanoma deaths are rising, but the truth is that virtually all melanoma deaths are avoidable if only these lesions are detected at their earliest possible stage. So often people will cite a barrier to going in to get their skin checked, the fact that they're fearful of surgery, cutting, or unnecessary surgery. The truth is now, surgery is not always necessary to distinguish a benign mole from a melanoma. DermTech Melanoma Test enables the non-invasive and painless diagnosis of your suspicious skin lesions and can help detect melanoma at the earliest possible stage using innovative technology. In my office, on a daily basis, I utilize the DermTech Melanoma Test to help me to diagnose melanomas. If I see a lesion of concern on my patient, or if a patient comes to me concerned about a lesion, I may opt to employ the DermTech Melanoma Test. It involves applying a smart sticker to the lesion of concern. I then circle the lesion with a marker and then painlessly and gently remove the smart sticker from the patient's skin. That process will collect cells from the lesion of concern. I will send a kit that includes 4 of those smart stickers off to a lab where it will get tested for the earliest genomic markers of melanoma. Typically, results are provided within 3 to 5 days to the practicing physician. And with this test, there's a less than 1% chance of missing a diagnosis of melanoma. So I'd love to just demonstrate how really simple and painless this procedure is. A smart sticker will be applied to the patient's skin where there is a lesion of concern. A marker will then be used to encircle the suspicious lesion, and then that smart sticker is gently removed from the skin in a painless fashion. Those skin cells that are collected are then again sent off to a laboratory to get tested for genomic markers of melanoma. But this test is really only going to be effective if it's utilized, which is why it's so important that everyone is reminded the importance of an annual skin check by a physician. So in conjunction with May, which is Melanoma and Skin Cancer Awareness Month, DermTech has made a pledge as part of their Stick It to Melanoma campaign, whereby for every individual who pledges to see their dermatologist and get their skin checked, DermTech will donate $5 to their nonprofit partner organizations that focus on skin health. For more information, you can visit dermtech.com, where you can learn more about the DermTech Melanoma Test and also about their Stick It to Melanoma campaign, whereby they're encouraging individuals to go get their skin checked.